I am 62 years old. I have a partner, Meg. We have two little schnauzers and reasonably recently retired. I was diagnosed with neuroendocrine cancer, which was a big shock to my world and to our world. And I did keep working for some time, but I came to the conclusion that the stress of the job, it was very demanding, wasn't good for my overall well-being. And I felt that that was the best thing for my health. And so the challenge then, of course, is to find other things to kind of keep you going, keep you stimulated. If I think about symptoms to diagnosis, it was probably about 7 years, which is pretty typical of a NETS patient. My symptoms, like a lot of patients with neuroendocrine cancer, could be related to other things. So I had heart palpitations, I had breathlessness, tiredness. Other people have a lot of gut issues. I didn't have that so much. There was never any kind of thing found. There was no conclusion to those kind of episodes. So they were just kind of single episodes that people thought might have been a heart condition or SVT or a gut issue or asthma or menopause, because I was menopausal age as well. So those symptoms kind of continued for quite a few years. It wasn't until I went to the GP and my GP was away, and I had a registrar who kind of felt my stomach area and said, look, there's a lump here near your liver and I think we need to get it scanned, which I thought, oh yeah, okay. I didn't think anything of it. When I went along to do the scan, unfortunately, all hell broke loose. It was one of those situations where you're being scanned and the nurse said, just a minute, I need to get the doctor. And from there it kind of went on a whole journey. It was quite shocking to not even know or ever heard of what that cancer was, to then work out what to do about it. Yeah, I think everyone was stunned because no one had heard of it, so they don't really know what to expect. I didn't know what to expect. The really important thing for Meg and I was getting ourselves educated about it and trying to understand what this was all about. And was I going to die really soon, or was it treatable? What was the story?
At the beginning, while we were still trying to get the diagnosis, it had been highlighted that something was not quite right. At that point, it was incredibly stressful. Jack and I are both corporate girls. We've grown up through a very corporate environment for most of our working lives, which has never been anywhere near a hospital or a medical process or system. So it was quite overwhelming.
My oncologist actually put me onto NECA, which is a support group. It's an amazing support organisation that helps patients understand the cancer, understand treatments, and navigate the medical system.
I think one of the things that Jack did pretty well and very quickly was to educate herself. She was able to really understand her diagnosis, get a sense of the prognosis, work through what the treatments could be. Through that education, we were able to then have quite good and open conversations.
It's kind of really getting yourself educated so that you can manage yourself, but also manage others and how they respond to you. I now have to do my injections with my oncologist, or you can do it at your GP. I chose to do it in the same care area as I have my oncologist, and that's really, really positive. Learning how to manage the anxiety is really hard. I still get anxious. I actually did go and see a psych. I got some help to help me process it a bit. At first I didn't, because I thought I'd be all right, but then I realised I really did need to think through my life. Like, it was a big life shock.
My observation of this profession is that they are the most amazing people. Irrespective of who we were dealing with, whether it was the nurse, the doctor, the oncologist, or even the pharmacist, we just found people to be incredibly supportive.
I think one of the biggest outcomes of that was to realise that work was such a big part of my life, but it also caused a lot of stress, and stress is really bad for cancer and for treatment and for healing. It probably took me about 18 months to 2 years to make a big decision to firstly slow down and then to really pull out. And then the other part of this, really thinking through was to take control of the things I could control and let go of the things I couldn't control. I can't control the disease, and it's a very unpredictable disease, but I could control my overall well-being. Things like exercise, what I was eating, my weight. I think I'm more balanced in my life now, which is really better for my overall health.